Morrison.
You can call me Carolyn.
Hi Carolyn, nice to meet you. And who's this you have with you today?
This is my daughter, Susie.
Nice to meet you, Susie. You guys want to have a seat? So it's nice to meet you both. I'm Jeff Hardy, Registered Nurse First Assistant at the Cape Breton Regional Hospital, and I'm here today to talk to you about your hip replacement.
RNFA practice falls under the umbrella of perioperative nursing and encompasses the preoperative, intraoperative, and postoperative phases of the surgical experience.
Before we get started, I have some information for you to take home. I also have this pamphlet that I made for you, just some general information about your surgery.
Preoperatively, the RNFA performs focused nursing assessments and communicates with other healthcare professionals regarding the patient's plan of care. Prior to your hip replacement, you and your coach will meet with our prehabilitation team who will help you prepare for your surgery. They'll also work with you to make sure you have everything you need in place before going home from the hospital.
Have you attended prehab yet?
Yes, I did.
Did you find prehab effective?
I actually really enjoyed it, and I learned a lot about my own health and about surgery that I didn't know before. For example, I learned that it would be beneficial for me to lose weight. I've lost 15 pounds since prehab.
Good.
I didn't quit smoking altogether, but I cut back a lot. And the thing I was most worried about was, you know, would I be all set for what was going to happen after surgery? So I didn't know if my home was set up properly. And they had occupational health go to my home and make sure that I had a raised toilet seat. I got a rental walker. I just kind of feel more secure and like I have everything in place and I'm ready to have surgery.
And who's your coach?
My coach is actually my daughter, Susie, that's here with me today.
Oh, that's great, because we find it very effective if you have a family member or a friend as your support person throughout this process. 2 to 4 weeks before your surgery, you're going to go to the pre-admission clinic. There you will be assessed by a nurse. The nurse is going to look at your past medical history, any previous surgeries, your current medications, and they're also going to send you for blood work and an EKG. Following all this testing, it will be determined if you need to have an anesthetic consult. This is a consult that you'll have prior to your surgery with the anesthetist. They'll go further in depth into your medications and your past medical history. So on the day of your surgery, you're going to want to bring your coach with you again. They're a very important part of this whole process. When you arrive at the hospital, you're going to make your way up to the day surgery department. There, another nurse is going to meet you again. They're going to get you changed for the OR, and they're going to ask you a few more questions. You may have heard a lot of these questions before. They're going to do your vitals again. And at this point, it would be a good chance for you or your coach to ask any questions you may have. When the OR is ready, someone from the OR will come get you and your support person and bring you to the holding area. There, you will see the anesthetist, the surgeon, and an OR nurse or myself. In the holding area, myself or one of the OR nurses will come to confirm your identity. And at this point, we're going to ask you a few of the questions that you've already heard. Following this, you will see your surgeon. At this point is when you're going to sign your consent for surgery. They're also going to ask you what side surgery you're having done, and they're going to mark their initials on that side. Then you're going to meet with the anesthesiologist. They're going to review your health history, and they're also going to go over any of your options for anesthesia.
During the intraoperative phase, the RNFA performs surgical first assistant techniques, such as using instruments, medical devices, and performing surgical site exposure. Also, within the RNFA scope of practice is handling or cutting tissue, providing hemostasis, suturing, and wound management.
I was just hoping you could tell me exactly what the procedure entails.
So for your surgery, once you're asleep or have your spinal, we're going to turn you on your side, the operative side up. At this point, we're going to prep your leg and we're going to put up some drapes to create the sterile field. The surgeon and I will then get started.
An incision is made above the operative hip and retractors are used to expose underlying muscles. The muscles are carefully repositioned in order to expose the hip joint. The hip is then displaced from the joint. The head of the femur is removed and the acetabulum or hip socket is fitted with the new cup.
As you can see here, we have a picture of a total hip replacement. As you may know, the hip is a ball and socket joint, and we're going to replace both. We replaced the socket with a new cup, as well as we replaced the femoral head with a new prosthesis. This femoral head will move inside this new cup, and between the two is a liner to help with the movement.
The shell and liner are positioned inside the acetabulum and may be secured with screws. The artificial femoral head is fastened to the new stem, which has been secured inside the femur. Muscles which were moved are carefully sutured back into place, and the incision is closed with staples or sutures.
So following your surgery, you'll go to the recovery room. There, a nurse will monitor your vitals, your pain control, as well as your incision site. You will recover there for a while until you're ready to go to the post-surgical unit.
During the postoperative phase, the RNFA may participate in postoperative rounds, assist with discharge planning, and identify community resources as needed.
So once you get to the orthopedic unit, you'll have round-the-clock nursing care. And if you have any concerns, they'll contact either myself or your surgeon.
On the unit, you will receive private and group physiotherapy. You may see a dietitian or other professionals if necessary.
The registered nurse first assistant is an OR nurse who acquired additional knowledge and skills. This person works with the entire surgical team to optimize patient care.